that $260 billion in legitimate medical claims are denied every year. It also says United Healthcare denied 1 in 3 in-network claims, and that Cigna used AI to reject over 30,000 claims in just 2 months. Meanwhile, over half of denials were overturned when the consumer appealed. Let's get some more insight by turning to Neil Shaw, chairman of Counterforce Health. It's a site that helps patients appeal denied claims through the use of AI. Good morning, doctor.
Good morning. Thank you so much for having me.
It's an important topic here. A new analysis of some 4 billion claims found that, among other things, prescription drug denials by private insurers in the U.S. jumped 25% from 2016 to 2023. Tell us first why it's so rare that we do get an inside look at a very complex system of healthcare claims and denials.
Yeah, I think what's happened, and I think what a lot of patients and even physicians across America don't realize is that in the last 3 or 4 years, the large health insurance companies have weaponized AI to programmatically deny claims at scale. So they're not even having doctors really spend hours or minutes reviewing these letters. Some news stories have come out that in 1.2 seconds, an algorithm will just make a decision to deny you. And then what's a shame is that patients and clinics across America have to spend 5-10 hours writing detailed letters to fight back. But yeah, there's been an escalation in denials of claims. I think in many key medications, 1 in 4, 1 in 3 claims that are denied. The statistics are, I think 60 million Americans have had a claim denied in the last year, 1 in 5 people on health insurance. So I think people are realizing health insurance isn't really health care these days.
Experts,
it's a tragedy.
Experts who study denials say that the skyrocketing cost of popular new weight loss drugs and greater automation are likely the 2 big factors leading to this change. Do you agree?
Yes, well, I agree. I would say, frankly, automation is the biggest. So I recently just published a book about it, Insured to Death, and it's now become unexpectedly a #1 bestseller in health policy. And people should take the time to read the book. But really, it's automation. It's AI. They're using AI to deny claims rapidly because it takes you hours and hours to write an appeal and fight back. And then these clinics don't have the time. They don't have the staff. Hospitals don't have the time, and individual patients don't have the time or even the access to knowledge. So this is something where we passionately believe that AI needs to be built for the other side. It's an arms race by AI, and patients and clinics don't have a chance without using AI themselves. So that's been our mission, and we've built a lot of cool AI tools to help people fight back.
This is almost like what happened when AI popped up in the classroom, right? Students got a hold of it, ran wild. Teachers were like, wait a minute, we need to know about this too. So you're saying that AI has been weaponized by the healthcare industry, but you yourself say your company is using AI to help the consumer.
Yes, yeah. So we actually, just as a passion project, I run, Care AI, which is a large elder care platform around the country. We built AI tools that we're offering to patients and clinics completely for free because we are so frustrated with this problem that people are experiencing. So people can come to the site, counterforcehealth.org, and just use free AI tools to fight back. It's not rocket science to build AI to help you generate a well-crafted appeals letters, study claims databases, write detailed citations for medical necessity. But this is something that an individual person might take 5 or 10 hours to do. A doctor doesn't have the time. A nurse doesn't have the time. So this is a perfect use case for AI, where it's like repetitive, knowledge-based, pulling information, parsing through coverage policy documents, and then creating something on the back end that then you can submit to your insurer.
And so for the person who says, look, I'm sick, I don't have time to fight this denial, I'm just going to pay it and move on. What do you say to that person?
No. Do not pay the bill. That's my #1 advice to everyone. You have a lot of rights. I wrote extensively in my book about it, so people should check it out. Like, you have rights to appeal to the insurance company. You have rights if multiple appeals fail. The state insurance regulators want to help you, so there's what's called an external review. You have so many rights. And if you simply bother to fight, I'll leave people with this. Of 99% of denials last year were not appealed because people didn't know their rights. Of the 1% of people that appealed, over half of them were overturned. And that's just one simple appeal. You do multiple appeals, your odds go up. So people have a lot of rights, they just don't know their rights. So I think at a minimum, this is a great public service announcement. Do not pay the first bill. If you get denied something, you have 5 different opportunities to get the care you need.
All right, it's the spark for a good conversation. Neil Shaw will have to leave it here. The head of Counterforce Health, thanks for your time this morning.
Thank you for the opportunity.
Of course, thank you.
Interesting to be sure. All right.